Good morning. Good morning. What is it about stories that we find so special, so inspirational? Stories are ways that we can connect the facts about medicine with the lives of our patients and our own lives. In medicine, stories have the power to heal, power to inspire, and sometimes even the power to change the world. Let me tell you a story about one of my patients. 2 years ago, I was called into an exam room to see Fatima. Fatima is a 16-year-old woman who is here from Somalia. She's a Somalian refugee. Her immunizations were up to date, and her chief complaint was that she was missing her prosthesis. Missing a prosthesis? I had to check it out. I went down the room, opened the door, and I found Fatima sitting with her head down. Her battered crutches were sitting up against the wall. Her father was sitting in the exam room because in her culture, missing a limb meant that she was family baggage. Hope was gone from that room. So we could offer her the traditional things from medicine. Fatima, there is an organization that actually helps people get a prosthesis. Head down, there was no eye contact. Fatima, I know a physical therapist that works at my hospital that has the same kind of amputation as you do, and maybe you'd like to meet her. Nothing. You know, oftentimes in medicine we're taught that it's about the patient story when we're in the room, but sometimes it's important to tell our own stories. So that day, for the first time in my career, I took a step towards Fatima, and I leaned down, and I pulled up my pant legs to reveal that I have 2 artificial legs. Fatima's eyes flew open. But how can you be the doctor when you wear a prosthesis? That story wasn't about words or medicine. That story is about learning and about connecting as human beings. That's why I'm here today, because I believe that your story has a role in medicine today. When I look around this room, I see the future of healthcare. I see people who faced challenges and diversity that's important to have your story help guide us for the future. Because it turns out, if you're in the United States and you're a minority, you are more likely to be sick. If you're in the United States and you have a disability, it's harder for you to get health care. If you're an immigrant, it's harder for you to get health care and harder for you to be healthy. That's why we need you to be part of medicine today, to bring your stories to help us move the healthcare in our country to change that system. And something else will happen when you're in that room. You're going to walk in that room and your story will be visible before you even say a word. That's why I'm here today, because I think your story is so important. So today, what I'd like to be able to do is hope that you walk away from this conference with 3 things. I hope you walk away the conference with the skills to better understand what it takes to become a physician in the United States. Secondly, I hope you'll walk away with understanding that becoming a primary care physician, where you have the relationships with people, is powerful for you, for your patients, and for our country. And lastly, I'd like to talk with you a little bit about what's possible, because I know that you face challenges to get to be in this seat, and the next steps in your career will have challenges, but it's so worth it. That's why I'm here today, because someday I know that your story was going to have the power to heal, the power to inspire, and the power to really change the world. So we're going to do that today in 3 parts. One, I'm going to tell you what it's like to be a family doctor, to be in primary care. The second part I'd like to talk about is why transforming our healthcare system is important to the people in our country. And thirdly, I'd like to talk with you a little bit about that challenge and skills and what understanding it takes to be able to move through those challenges. So if I ask you, what's a family doctor? It'd probably be more like, who do you see to get your health care? It's probably somebody that's a primary care doctor. Somebody that takes care of you when you're healthy, that helps you get your immunizations. somebody that takes care of you when you have pneumonia, when you get acutely ill, or break your ankle. And importantly, somebody that helps take care of coordinated care when somebody is sick for a long time, that has diabetes or high blood pressure. That relationship we have with patients is important over time, but it's especially important in two times of life. And I'd like to do that by telling you two stories. I'd like to introduce you to Christy. Christy's one of my patients, and you can see this is her graduation from high school photo from about 3 years ago. Anybody here graduated from high school about 3 years ago? It turns out that the first time I met Christy wasn't when she graduated in high school. It's when she came to see me with her mother, Diane, and her father, Todd. And the first time I met Christy was when I put the Doppler on Diane's stomach. And Diane and Todd and I heard Christy with her heartbeat. Babies' heartbeats are faster. They're about twice as fast. Her mom's heartbeat was slow. And it turns out that Todd and Diane were nervous, but hearing that heartbeat, helping Christy through that phase of pregnancy was important and calmed them. When it came time for Christy to enter the world, man, Todd and Diane were nervous. But when Christy showed up, all messy and crying and things, Todd's hands were steady when he reached out and I helped him cut that cord. Together we watched Christy grow and thrive, got her immunizations, her first steps, and now she's sitting in a stadium just like you guys are, trying to decide how she wants to make a difference in the world. It turns out that experience of being a family doctor is really important. Being a physician is important at the beginning stages of life and in another time of life too. I'd like to introduce you to another patient of mine, another story. This is Barbara. Now, this is an older photo of Barbara because when I met Barbara, she was in her late 60s. She'd been married for 42 years. And she actually had an incurable disease. What do you do when you're a physician? We think of ourselves as having the tools to cure disease, but sometimes the most important things aren't about curing. It's about helping someone live the life that they need. With Barbara and her husband, we talked about getting her the extra skills, nutrition, and talked with her about what she wanted to have for the end of her life. What Barbara told me was she didn't want to have her life end in an ICU with beepers and bells and spotlights. She wanted to be in the company of people that she knew and loved. And when it came time for the end of Barbara's life, there's forces in medicine that push people into the ICU because we can do more. And Barbara said that she'd had enough. The things that we would do wouldn't extend her life. It would have extended her suffering. So I sat with Barbara and her husband, and I called her daughter in Minnesota, and we sat and held hands. And you could hear her breathe. And that's why that relationship is important. As Barbara left, she left the world surrounded by her loved ones and surrounded by care. It turns out that relationship is why we stay in medicine. You know, you come to medicine thinking, I came to medicine thinking, it's about science, it's about science, but you stay in medicine because of the relationships with Christy and Barbara and those folks. And what we're discovering today is that relationship value isn't just interpersonal value, it also brings real economic value that's helpful for our country. Because the truth is, when you have a relationship with someone over time, they end up having higher quality care, lower cost, and most importantly, better health care for them as people. So, being in primary care, being in medicine, means that you can have the skills to be able to take care of people like Christy and Barbara. It means that you want to finish up your medical school and practice in an underserved area, primary care is great. You want to go abroad and look at population health in an area that's underserved in the world? Primary care is great. Family medicine is the right tool for that. How would you like to practice in the neighborhood you grew up in? It turns out that it's also the right skill set, because that skill set is important to help us transform healthcare for those people, but also for our country. What I'd like to do is now take a second and talk with you a little bit about some challenges that we have as a country in healthcare, and how excellent primary care really can make a difference for that. You've probably seen some slides. Right now in our country, we're spending a lot of money on medicine right now. We're spending almost 18% of our gross domestic product. That means for every dollar manufactured, every car sold, it's about 1 in 6 of those dollars is spent on healthcare. And that's going up. Healthcare is also expensive for people. The average family is now spending over $19,000 out of their own pocket. That's not really affordable for most Americans. And you might be able to justify it if what we were getting was really the tremendous value that we're paying into it. But when you compare our healthcare system with other healthcare systems, I hope you can see on this slide that the higher you are, this is life expectancy, the higher you are in life expectancy, the higher you are on the graph. And as you go to the right-hand side, the chart, that's how much more money you're spending. It turns out a lot of countries are spending half amount of money as we are and getting better life expectancy. They're getting better infant mortality. The truth is the United States is 37th in the world in rankings for quality and healthcare outcomes. And we're 52nd in the world in terms of for healthcare equity. And there's a couple reasons for that. One of the reasons is because there's so many uninsured people in the United States. And when you're uninsured, it's more likely for you to be sick, more likely you to have expensive care that's found later in your disease, and you're more likely to die. The other thing is it's because we don't really have a health care system. A health care system looks at how we take care of health care across the spectrum. In many ways, we have a wealth care system. A health care system that's designed to be able to produce profit. And it has some incentives that are a little perverse. Anybody here watch basketball? Nobody here watches basketball. It's a little bit like, we have the greatest basketball players in the world here. Imagine if we took the greatest basketball players in the world and took them to the Olympics, and we told them, I'm going to pay you, each basketball player, I'm going to pay you for the number of shots that you take. Think about what I just said. Not the amount of baskets you make, not the amount of points that we score as a team, but if we pay each player for the number of shots they take, what are they going to do? Everybody's going to try to shoot, to drive up the number of shots taken. In the United States, we pay you for what you do. We pay for volume. We pay for the number of shots you take in medicine, the number of times you do an operation. We don't pay for keeping people out of the hospital. We don't pay people for sitting down as much to be able to talk about keeping your patients healthy, about diabetes, about making certain that they need what they want. And that's an altered way of being able to do things. We have good news, though. Research is showing us that if somebody has two things. If you have health care insurance, and secondly, if you have a usual source of care, best primary care, you're going to have higher quality, lower costs, and better outcomes for people. This is the work from Barbara Starfield. It's true in other countries in the world that have better outcomes. They have more primary care. Here's the secret. It's also true in the United States. If you study where's the highest quality healthcare in the United States, it's in places like Grand Junction, Colorado, a little tiny town. It's in a real red state, but they have a number of primary care doctors that work as a system. If you go to group health in Seattle, higher quality, lower cost, in a system that uses primary care as a team captain. The Cleveland Clinic, it's the same thing. If you incent quality by building relationships with patients, people do better. Uh-oh. What about the Affordable Care Act? I know there's a lot of controversy. You might hear some things. It's not a perfect bill. There are people on both sides of the United States screaming and yelling about this in Washington, D.C. right now. But the Affordable Care Act does some very important things for our country. It means more Americans will be insured. It means the insurance that people have can't be taken away because you're sick. It means that we're trying to move the healthcare system to be able to have that better team-based care. So sure, we have to improve some things in this healthcare bill, but we also have to be able to help the things that work move forward. If you poll Americans about Obamacare, there's a little more than 50% are against it. If you poll Americans about the Affordable Care Act, more people are for it. If you ask people about the principles, do we want more people insured? Do we want to make it so that you can still get insurance if you have a pre-existing condition? People support that. And they support that because it helps their families. So I'm going to have to tell you a story about that. I got a call from a newspaper reporter and said, can you name just one of your patients that's been healthcare could be improved by the Affordable Care Act? So I have to introduce you to Mr. Akimbo. Mr. Akimbo moved from Haiti. He's not a Native American speaker. He was a legal immigrant. He is so proud of his granddaughter. His granddaughter, who's going to community college, she'd come in and she would translate for him. And Mr. Akimbo had diabetes and high blood pressure that with a few pills and seeing me every few months, he was doing great. And remember a few years ago, about 2008, 2009, when the economy tanked for a little bit? Mr. Kimbo lost his job where he was working in cleaning and maintenance, and he didn't come and see me. He disappeared from my office. When he came back into the office 9 months later, his granddaughter was worried. He was worried because his legs were swollen. It was harder for him to walk. He was getting short of breath. What had happened to Mr. Kimbo? He couldn't afford, because he lost his insurance. He couldn't buy insurance because he has diabetes and hypertension, and no one would give him insurance. He couldn't afford the medicines. So he stopped taking his high blood pressure and his diabetes medicines. He'd had a heart attack, and he was in kidney failure. Mr. Kimbo's story illustrates two things. If he would have had insurance, the ability to continue to have insurance, he'd be able to dance at his granddaughter's wedding. If Mr. Kimbo had a primary care doc, be able to help him through that, we could have found him those $4 pills at Walmart to be able to help him get through that. It's an important lesson in terms of where we need to go with our healthcare system. So, as you look at what's happening with the Affordable Care Act, what's happening in business outside of that, we're now moving towards paying for value instead of paying for volume. What happens when you do that? It turns the healthcare system on its head. It used to be, in the old system, the more beds that were full in the hospital, the better you did. If you're paying for value, you really want people to be healthier, to be able to get better primary care, to be able to take care of their diabetes and not have to go to the emergency room unnecessarily. It really builds the importance of a team of healthcare providers. And that role, primary care, the reason that your doctors went to medical school, is valued in a different way. So the third part I wanted to talk with you about, we're going to talk a little bit about a challenge. We talked about what is primary care, why primary care is important. I want to introduce you to a man that's had a little bit of challenge. He sat in a seat just like yours here. This gentleman's name is Kent, and he was one of my residents. After you finish medical school, no, let me change it. When you guys finish medical school, you'll choose a specialty career. And in your specialty career, you'll practice as a resident under the supervision of faculty members and team physicians. Kent was one of my residents. Kent initially didn't set out to be a doctor. He actually set out, he was a team physician where he'd tape ankles in high school. He had a family, and he decided he wanted to be able to do more than tape ankles. He wanted to take care of the whole person. So he went back to medical school, and it was hard for him. By that time, he had a family. It was expensive. He had to stay up late at night after he put the kids to bed. But he had to stay late studying. But the good news about Kent is the way that he talked to his patients, the relations he had, were spectacular. Kent had a hard time. I had to work extra hard to help him through the residency program. But you know what? He takes great care of his patients. And today, I visited Kent in his office, and he's a family doctor, and he's a team physician. Kent sent me a letter. He said, when I became elected to the president, he said, I remember, Doc, when I was your resident, I'd come into the preceptor room where we'd talk about patients, and I was afraid of you at first because you were pushing me about my patients. But then I realized that you're pushing me to help with my patients. And then I looked forward to that. Now he says, you're pushing me to change my medical practice, so I have electronic health records, so I work as a team, I have a dietitian in my office. And he says, and that's hard work, but it's worth it because it takes better care of my patients. So I know you guys, it's hard work being in a community college, it's hard work taking the MCAT, but I have to tell you, it's worth it. Ask Kent. Ask Kent. I'm also going to tell you that it's worth it in some of my own story. Barbara Starfield, Paul Grundy have all this research that shows how primary care has the values we talked about. I don't need to see that research because I have my own personal story. About 15 years ago, I got a little scuffed up. This is my face. If you, let's see, there's infraorbital ridge, a mandible, a Lafort fracture, 2.5. There are 80 screws and plates in my face. I woke up in an ICU. The same ICU I had made rounds in the week before. My family doctor came and saw me, and this is a picture of my foot. It has a tibia fracture, a fibula fracture, a fused midfoot. Deinnervation means I couldn't feel that foot. That's a lousy foot. My family doctor showed up when I was on a ventilator, and when I woke up, we had the music that I've cared about in the world, Mozart playing. We had sunlight coming in that window, and we had my family doctor who's there every single day, 2 weeks in the ICU. Every single day, 2 months, I was in the hospital, until I said, Tim, you got to go home. you can't keep coming in and seeing me. But Tim was able to take care of all of me. I had a doctor that took care of my face, put my face together. I had another one put my foot together. Another one put my arm together. Another one managed the ventilator. But Tim was the person that took care of all of me and understood what I needed to go forward. Understood what it took to be able to coordinate that team of folks. And I want to introduce you to a prosthesis. Prosthesis, look closely, that's pretty cool. There's a carbon fiber socket, there's a vacuum system, an energy return foot. But you know something? Your leg isn't designed to put weight in that. And the first time you put your weight on that, it hurts. Every single step. Why would you do that? Why would you put your weight on that prosthesis? Look over the corner, see that wheelchair over there? You know, you could get almost anywhere you want to in that wheelchair, right? Almost. The reason that you go through that discomfort to take a step forward is because it's time to get back to see Christy. It's time to get back to see Barbara. It's time to talk to Kent to be able to help moving forward. It turns out when there's something that you understand and can see that's more important than the challenge or the discomfort or the pain, that's what draws you forward. What's drawing you forward today, I hope, is to be able to take care of your Christy, your Barbara, that future there. And I have to tell you, it's not just medicine that pulls you forward. Tim knew that I grew up, my dad was on the ski patrol. We did all kinds of wild, fun things outside of Mount Hood in Oregon when I was growing up. And Tim was smart enough to be able to say, it's not just getting you back to a clinic, it's getting back to a full life. Initially, we talked to people and they said, okay, you've lost 2 legs, so we can get you back up in the mountains, but you're never going to stand up and ski or snowboard or ride your bike standing up again. That felt like getting punched in the gut. That's not losing a leg. That's losing a life. But you know what? My family doctor said, Jeff, no. We're not going to listen to those people. We're going to call a team of experts, the National Sports Center for the Disabled in Winter Park, Colorado. And we called them, and they invited me to be able to go out with them to be able to learn what is possible with the prosthesis. It turns out you have to do things a little different. You got to learn how to modify something. You got to be able to modify the water ski. It turns out it's important that you don't ask, can I do this or not do this? It turns out you got to try to be able to modify your equipment and what you can do. It turns out that you can get up in the mountains again and be able to rip it. This is a ski bike. We invented this together with the Winter Park National Sports Center for Disabled. It wasn't enough to be a mono ski. This actually unweights. It's like a bike, except it's got skis. And it carves turns. It rips. And what happens when you do something like that? In medicine, when you learn something new, what you do is you test to see if it works. You write stories about it, and then you teach other doctors to do it. What happens when I got to be able to do this for the first time in the United States? It was a new device for us. I invited other people. We wrote stories about it. We wrote stories in the Professional Ski Instructors of America Journal. We invited a gentleman up who had spinal muscular atrophy, has no quadriceps muscles, can't walk upstairs. His 3rd day, he did 10,000 vertical feet at Vail, Colorado. Turns out you get invited to teach classes. This is one of my classes. I got invited to be able to teach classes in the Alps. In Europe. But look closely at these guys. The guy from the right, they're all world travelers. The guy from the right just got back from Iraq. The guy then on the next to him just got back from Afghanistan. Who are these kids? These kids were privates and sergeants in the U.S. military that went abroad and came back with their lives different. You know, these kids didn't have the advantage I had growing up. They didn't have a dad who was a ski school and a ski patrolman instructor. These kids had never been in the mountains. But by the end of the first week, anybody ever seen a ski lesson? You know, the instructor comes down and then stops, and the students come down after that. These guys were ripping big turns. Came up, sprayed me. Doc, they said, this is the greatest day of my life. You know something? That was one of the best days of my life. Because that challenge, that diversity, put me in a different place to be able to make a difference in somebody else's life. Those kids would have never been in the mountains, and they discovered something new that's possible. So my hope when I came here today was to be able to talk with you about 3 things, right? My hope was to be able to talk with you about how to be able to become the skills to become a physician, to be able to make a difference in people's lives. My hope was to be able to talk with you a little bit about the importance of primary care and changing our healthcare system. And the last thing I was hoping to be able to do is talk with you a little bit about what is possible. Because I believe that when we take your stories with what you learn in medical school, we're going to make a difference in people's lives, just like we're talking about with those kids and with Fatima. And the last patient story I have to tell you is just recently I was asked to be able to come into a room in a patient of mine and to actually see an 18-year-old Somalian refugee. What are the odds? Who was an amputee. And I opened the door, and who do you think I found 2 years later? It was Fatima. And Fatima now has a prosthesis. Fatima is now in a community college, and she now speaks English, and she was wearing a smile. Because Fatima had learned that sometimes a challenge, sometimes a difficulty, can be able to place you in a new place. I'm looking forward to the day when you guys can be able to look out in this audience and tell your story, because your story of challenge, of diversity is important to healthcare for our country. There's a day I hope you're going to be able to stand up here and talk about how your story in medicine has the ability to heal, to inspire, and to change the world. Good luck with your careers. Thank you for being here.